Thank you, Dr. Rakesh, for putting a very pertinent question. Traditionally, obstetricians have just looked after the physical health of mothers. As a mother of an 11-year-old son, I can very well relate to the myriad of emotions that a mother faces. Tanushree ma'am was sharing some of her experience. I also feel I'm playing the same role. So, as an obstetrician, nowadays we feel it is very important we provide them with emotional support, tender loving care to our expectant mothers, as well as, of course, the postpartum mothers. That is the most stressful period, believe me. Yeah. I think both Professor ৎসকগণ ma'am and Tanushree ma'am will agree with me.
Absolutely, ma'am. My next question is to Vijay sir. As a leader in your field, what is the one concrete commitment or call to action would you like to make to specifically advance women health over the next 5 years?
Well, we are in the clinical space. That is something that we do, so we'll continue to do that. But what I increasingly realize is that the role that we should play in terms of building the community awareness through sharing the knowledge, in many cases even function as a bridge. Today, our gynecologist, as she was mentioning, the mental health is very important. So you need to sort of, through the 9 months journey, not just treat the physical health, but also constantly assess and keep guiding them as to what are the other, mental inputs that they need to take to be very strong, right? So you need to anticipate. You don't just jump into it. It needs to be planned. Earlier, there used to be a huge, large family that used to be there to support. Today, families have become very micro. Both the couples are working. In fact, some of the issues that we face in a city like Bangalore, where both the couples work, is that the baby starts talking very late. Right? Because the conversational skills are not developed because the parents are out working. They come back in the night and then they are busy. As a result, the child starts talking very late. So today our pediatricians engage and sort of impress upon these couples to try and make time for the child, to engage with the child, to develop the motor skills and even cognitive skills. And so the hospital's role is not just the clinical role, but it is expanding beyond the clinical and becoming a societal role. So I would say our focus will continue to be engaging on both the sides and advancing ourselves in both the sides to be a very effective contributor to the society.
Thank you, sir.
I can tell you one story. You see, that time I was the head of the department at ৎসকগণ Medical College. And in ৎসকগণ Medical College, there was a center of excellence for microsurgical recanalization. It was very famous. One day, one doctor from Gangtok came to me and narrated a very sad story because he and his wife, both the doctors, were in the chamber and their 2 children, one boy and one girl, and their mother was at home in Gangtok. But due to the landslide, all of them died immediately. They're really, you can understand, they're very upset and going everywhere because the lady doctor, his wife, has sterilization done about 10 years back, and she's about 38, 39 years. She then he went to Delhi, and somebody in Delhi told them, you go to Dr. ৎসকগণ at ৎসকগণ, there is a center for recanalization, see what can be done. So I told him, bring your wife, let me find. And when he did the microsurgery, we found that one tube is lost already. One tube, but I did the recanalization. They are very upset. They are expecting pregnancy every month, but they could not. After 6 months, there was a conference in Shiliguri. I went there. They came down from Gangtok and tell me what to do. I said, look, you just wait for 1 or 2 months more. If not, I will send you for IVF. But that time IVF was not as successful as it is now. But after 2 months, he said, Madam, this is pregnancy test is positive. I'll bring my wife to Calcutta. I said, don't bring, because road from Gangtok to Shiliguri is very bad. We can have abortion. So, but he used to ring me every month. I said, look, don't bring also to Shiliguri. Be there. And your doctor, you ask your doctor to talk to me. And then, ultimately, at the end, he said, look, madam, I am coming to Calcutta for delivery. I said, don't come, because you will be delivered there. Ask your doctor to talk to me. And delivered. Really, we are all happy. He had a son. Okay. I went to Gangtok for DNB examiner, not an expert, as this time wanted to start DNB examination there. And then I met them. They are very happy. After a year, said, no, madam, my her pregnancy test is positive. I said, thank God. So, delivered again a girl. So we are all happy because they lost boy and girl and they got it. After 2 years, I again went to an examination.